Imagine for a second, your heart, the tireless engine that keeps you alive, is screaming for help, but not with chest pain. It's sending silent, visible signals right on your skin. Signals that most people ignore, mistaking them for fatigue, old age, or even a simple cold. I'm Dr. Mark Johnson, a cardiologist with over 20 years of experience, and today, I'm going to reveal how your skin can be the first and most accessible control panel for your heart's health. Get ready, because what you're about to discover might not only change your perspective on your health, but literally save your life, or the life of someone you love. Stay with me, because with each sign, you'll understand what your body is trying to tell you and how to act. For decades, medicine has trained us to look for heart problems in clinics with complex tests, electrocardiograms, stress tests, and a battery of lab analyses. And yes, these are fundamental and irreplaceable pillars in diagnosis and treatment. But what I've learned in over 2 decades of clinical practice, and what I see confirmed in my office every single week, is that the human body is a perfect orchestra, an interconnected system where every part reflects the state of the whole. And when a vital instrument like the heart starts to go out of tune, it sends echoes and warnings throughout the entire system. And often, the first whispers of a troubled heart don't come from a heart monitor, but from something you see in the mirror every day, something you touch and feel: your skin. The skin, the largest organ of our body, is a surprising mirror of our internal health. The reason I'm dedicating my time to this video today is because I've seen countless patients come into my office, or worse, into the emergency room, with visible signs on their skin that had been there for months, sometimes years, and were completely misinterpreted. They had all the warnings, all the clues, but they didn't know what they were looking for or what they meant. Today, I'm going to change that for you. I'm going to give you the knowledge to decipher these signs so you can be proactive and take control of your heart health. This isn't about creating panic, but about empowering you with vital information. I vividly remember Mr. Robert, a 68-year-old retired man who considered himself healthy as an ox. He came in for a routine checkup with no specific heart complaints, just a tiredness he attributed to old age and not being 20 anymore. But as we talked, and I did a general assessment, I observed his legs and hands. He had a subtle but persistent swelling in his ankles, and the skin on his shins had a slightly darker color than normal, almost a brownish tone. He had 3 of the 7 signs I'm going to show you today. When I asked him about it, he said, "Oh, doctor, that's normal. I've always had a bit of swelling at the end of the day, and these spots, well, I guess it's from the sun or age." He had ignored these signs for over a year. Subsequent tests revealed early-stage congestive heart failure, which had been silently progressing for more than a year. If he had known what to look for, if he had interpreted these skin signs as serious warnings, we could have acted much sooner with simpler interventions, preventing the disease's progression and significantly improving his quality of life. The Brazilian Society of Cardiology estimates that millions of Brazilians live with undiagnosed heart disease, and many only find out when the condition is already advanced. It's a frightening number, and most of these people had visible signs that were missed. So today, I want to show you exactly what I showed Mr. Robert. 7 signs that might be on your skin right now, and that almost nobody recognizes as heart alerts. For each one, I'll tell you what most people assume it is, what's actually happening inside your body, and one simple daily habit you can take to protect yourself. Pay close attention, because the next sign might be the one you're ignoring, and information is your best defense. The first sign is something almost everyone has experienced and, invariably, attributes to tiredness. A long day on their feet, a plane flight, or even excessive heat. I'm talking about that swelling in your feet and ankles, especially at the end of the day, that leaves a deep sock or shoe mark. Yes, this happens to everyone occasionally, and in many situations it's perfectly normal and temporary. But I always ask my patients, is this happening regularly, without a clear, apparent reason? And does it not significantly improve with overnight rest? Or does it even worsen throughout the week? Because if the answer is yes, we need to talk about what's actually happening inside your body. Persistent swelling, what we doctors call edema, can be one of the earliest and most visible signs that your heart isn't pumping blood efficiently. When the heart weakens, it has difficulty returning blood from the lower limbs to the rest of the body against the force of gravity. The result? Fluid begins to accumulate in the lowest parts of the body, mainly in the feet and ankles. Think of your heart as a water pump in a two-story house. If the pump is weak, the water can't climb back up to the main reservoir upstairs and ends up pooling on the ground floor, creating an unwanted puddle. This fluid accumulation isn't just an aesthetic discomfort or a feeling of heaviness. It's a clear sign that your circulatory system is under stress and that your heart might be working overtime, struggling to fulfill its function. The American Heart Association and the Brazilian Society of Cardiology point to lower limb edema as a common and early symptom of congestive heart failure, a serious condition that needs attention. Do not ignore this swelling. My daily recommendation for you, which can make an immediate difference: elevate your legs for 15 to 20 minutes whenever you can rest, placing them above the level of your heart, perhaps with some pillows. This helps drain excess fluid back into the central circulation and, crucially, drastically reduce your salt intake in your diet. Salt makes your body retain more fluid, which not only worsens swelling, but also further overloads your heart. Start reading food labels today, not next week. It's a simple but powerful step for your heart health. And if the swelling is new, worsens rapidly, or is accompanied by... The second sign is one that my patients describe as the most alarming and visibly concerning because it's unusual and catches attention. I'm talking about lips, fingertips, or toes that appear bluish or purplish. Many people think it's just cold, or that they've always been like that. It's my circulation. And yes, exposure to intense cold can temporarily cause this, as blood vessels constrict to conserve heat. But if you notice a persistent bluish discoloration, even in warm environments or for no apparent reason, take this very, very seriously. This discoloration, which we doctors call cyanosis, indicates that the blood reaching these areas isn't receiving enough oxygen. It's as if your blood is tired, with low energy, and can't deliver the vital oxygen needed to the tissues. The heart and lungs work together in a synchronized dance to oxygenate the blood and distribute it efficiently throughout the body. If the heart isn't pumping efficiently, or if there's an underlying lung problem affecting blood oxygenation, this lack of oxygen manifests on the skin, especially in the extremities, where blood flow is furthest from the heart and, therefore, most vulnerable to deficiencies. Imagine a car with a failing engine and a clogged fuel system. It can't deliver enough fuel to all the wheels, and the last ones run out of power, out of energy to function. Your body is showing you that there's a critical failure in oxygen delivery, a problem in the vital supply line. Research published in the Journal of the American Heart Association and in various cardiology journals shows that peripheral cyanosis can be an early indicator of undiagnosed congenital heart disease, advanced heart failure, or severe lung problems that directly affect heart function. 2 actions I recommend for this sign, which can be crucial. First, pay attention to your breathing. If you experience shortness of breath, excessive fatigue, dizziness, or chest pain along with cyanosis, seek medical help immediately. This could be an emergency. Second, if you smoke, stop. Smoking drastically compromises your blood's ability to carry oxygen, damages blood vessels, and overloads the heart. It's not an option. It's a necessity for your survival. If you've noticed this, don't wait. Every minute counts when it comes to oxygenation. The third sign is one that hides in plain sight, often mistaken for something harmless, like an uneven tan or an age spot. I'm talking about those reddish or purplish patches, often with a rougher or even scaly texture that appear on the legs, especially around the shins and ankles. People often say, "Oh, doctor, it's an age spot," or "I think I bumped into something and don't remember." And yes, it could be. But there's a specific pattern of discoloration that I, as a cardiologist, look for very carefully. When blood circulation in the legs is compromised due to a weak heart that can't pump blood back efficiently, or due to damaged veins that can't return blood to the heart properly, blood can pool in the legs. This accumulation of blood causes red blood cells to leak from small vessels into the skin tissues. The iron present in these red blood cells, when deposited in the skin, causes this dark pigmentation, which we call ochre dermatitis. It's as if your plumbing system had small, chronic leaks in the lower pipes. and the rust from the water was permanently staining the wall from the inside. The skin is telling you that blood flow to that region is inadequate, that there's blood stagnation, and that there's an accumulation of waste products that aren't being properly eliminated. A study in the Brazilian Journal of Angiology and Vascular Surgery and in international publications highlights ochre dermatitis as an important marker of chronic venous insufficiency, a condition that, if left untreated, can lead to more serious problems like ulcers and thromboses, and is frequently associated with underlying heart problems or an increased risk of developing them. The daily habit here is fundamental and can greatly alleviate symptoms. Wear graduated compression stockings, especially if you spend a lot of time standing or sitting. They are designed to apply gentle, gradual pressure, helping to push blood back towards the heart, improving venous circulation, and take short walks or perform foot and ankle movements throughout the day to activate the muscle pump of your calves. Even 5 minutes every hour makes a big difference for your circulation. Do not underestimate the power of these small movements and compression. They are powerful allies against blood stagnation. The fourth sign is one that becomes genuinely dangerous and, unfortunately, leads many patients to critical situations, such as severe infections and even amputations. I'm talking about wounds, cuts, scrapes, blisters, or even small insect bites on your feet and legs that take an eternity to heal, or that simply don't close, even with basic care and hygiene. "Oh, doctor, I had a blister from my shoe 3 weeks ago and it's still open. I thought it would close on its own like always." Most small wounds heal on their own in a few days, with the help of our immune system and good circulation, but not when circulation is compromised. When the heart isn't pumping oxygen-rich blood, essential nutrients, and defense cells, like white blood cells, efficiently to the extremities, the body loses its ability to heal quickly. The defense cells and growth factors, essential for tissue repair, simply don't reach the wound in time and in sufficient quantity to initiate and complete the healing process. The wound remains open, vulnerable to bacterial infections, and can become a gateway to much more serious problems that can spread rapidly. Think of a garden that needs water and fertilizer for plants to grow and recover from damage. If the hose is clogged, the water pressure is weak, or the fertilizer doesn't arrive, the plants don't receive what they need and can't recover. This is exactly what happens to your skin and tissues when circulation is deficient. The American Heart Association and the Centers for Disease Control and Prevention, CDC, warn that difficult-to-heal ulcers on the legs and feet are a classic sign of peripheral artery disease, PAD, which is a strong indicator of heart disease, risk of heart attack, stroke, and in severe cases can lead to the need for amputation. After showering, examine your feet and legs carefully, including between your toes and on the soles. If you see any wound, cut, or blister that doesn't improve within 48 hours, clean it with mild soap and water. Apply a gentle antiseptic and cover it with a sterile dressing. And most importantly, call your doctor. Don't wait a week. Don't wait to see if it gets better. 48 hours. Your proactivity can prevent very serious complications and preserve your limbs. The fifth sign is one that surprises most of my patients because it seems completely harmless and is often considered just an aesthetic issue, a natural sign of aging, or a family trait. I'm talking about those small, yellowish fatty deposits that appear on the eyelids, usually near the inner corner of the eye, or even in other areas around the eyes. We call these xanthelasmas. "Oh, doctor, that's just a bit of fat. My grandmother had it too. It runs in the family. It doesn't bother me." And yes, they are fat deposits. But what they are telling you about your health is much deeper, more urgent, and potentially dangerous. Xanthelasmas are a visible and early sign that you may have elevated cholesterol levels in your blood, especially LDL cholesterol, the so-called bad cholesterol, and triglycerides. And high cholesterol is one of the biggest and most dangerous risk factors for heart disease, such as atherosclerosis, where arteries gradually become clogged with fatty plaques, leading to heart attacks, strokes, and other severe cardiovascular complications. It's as if your body is trying to get rid of the excess fat circulating in your blood, and one of the few places where it can deposit this fat visibly and relatively harmlessly is on the eyelids. If you see these small deposits, it's a clear warning that your lipid profile may be dysregulated and that your arteries may be at risk, even if you don't feel any other symptoms. A study published in the British Medical Journal and other reputable scientific journals has shown that the presence of xanthelasmas is associated with a significantly increased risk of ischemic heart disease, myocardial infarction, and premature death, regardless of other known risk factors. My daily recommendation for this sign is twofold. First, include more soluble fiber in your diet. Oats, apples, beans, lentils, broccoli. They help reduce cholesterol absorption in the intestine and aid in its elimination. Second, and crucially, talk to your doctor about the need for a complete cholesterol test, including LDL, HDL, and triglycerides. It's not just a matter of beauty or having a bit of fat. It's a direct alert from your heart about a silent danger that needs to be investigated and treated. The sixth sign is one that tells me how far things might have progressed. When I see this in a patient, I know the damage is no longer early, and that attention needs to be redoubled and urgent. I'm talking about cold and pale skin on your legs and feet, which persists regardless of the ambient temperature. Doctor, my feet have always been cold. My wife has been stealing the electric blanket for 30 years. It's normal for me. And I understand. We laugh together. But then I ask, are your feet cold in the summer? Are they cold under 3 blankets? Are they cold even when the rest of your body feels warm and you don't feel cold elsewhere? Because that's when I become deeply concerned. Cold and pale feet and legs that don't warm up are a strong indicator of significantly compromised blood circulation in the lower extremities. Your blood vessels may have narrowed or hardened due to the accumulation of fatty plaques, atherosclerosis, to the point where warm, oxygenated blood simply cannot reach the tips of your feet in sufficient volume. It's as if your circulatory system were a central heating system in a large house. If the pipes are narrow, clogged, or damaged internally, the heat doesn't reach the furthest rooms of the house, no matter how hard the heater is working. The room stays cold, not because of the weather outside, but because of the internal pipes. The Brazilian Society of Angiology and Vascular Surgery and the American Heart Association identify peripheral artery disease, PAD, caused by narrowed blood vessels as a condition affecting millions of people, with heart disease, diabetes, and smoking being the biggest risk factors. Cold and pale feet are one of its most consistent and early symptoms, often preceding pain or other problems. The best response here is a routine of aerobic exercise, starting with a 30-minute brisk walk every single day. Not a leisurely stroll, but a purposeful walk, swinging your arms, that slightly elevates your heart rate. This forces blood circulation into the feet and lower legs, strengthens blood vessel walls, and over time can reverse some of the early narrowing. Start with 10 minutes if 30 feels like too much, and gradually increase. The important thing is to start today and be consistent. Your heart and your legs will thank you for this effort. And if the pallor and coldness, the seventh and final sign is one that almost nobody ever talks about, one that I rarely see in patient brochures, and that many healthcare professionals might even overlook in a quick assessment. But once you know it, you will never unsee it, as it is a silent and powerful indicator. I'm talking about toenails that become brittle, grow very slowly, or appear thicker, discolored, yellowish or grayish, and even deformed. Oh, doctor, it's fungus. Or, I think I hit my foot, and the nail became like that. It's normal for someone who wears closed shoes. And yes, it could be fungus or trauma, and these are common causes. But there's a specific pattern that stands out. Hair follicles and nails need a constant and robust supply of blood and oxygen to grow healthy and strong. When circulation is significantly impaired by long-standing heart problems or by peripheral artery disease, PAD, the toenails slowly stop receiving what they need to develop normally. Over time, they become weak, brittle, discolored, or grow abnormally slowly and thickly, often with a dull appearance. This change in the nails is a visible marker of blood vessel damage that has been progressing, in many cases for years, even before other more obvious symptoms appear. Think of your nails as small plants in a garden. If the irrigation system is having problems, if water and nutrients don't arrive adequately, the plants don't die immediately, but gradually stop growing healthy and vibrant, showing signs of malnutrition. The absence of normal growth or the brittleness and deformity is your body sending a silent message about the health of your blood vessels especially in the extremities. Research in the Brazilian Medical Association Journal and in dermatology and angiology journals correlates changes in toenails with peripheral vascular disease in cardiac patients, being a reliable and often overlooked sign. Right after this video, look at your toenails. If they are significantly more brittle, slow-growing, or have a very different appearance than normal, and you don't have a clear history of fungus or trauma, schedule a blood glucose test this week, not this month, this week. A simple observation can be the first step to changing the trajectory of your health and preventing bigger problems. We've covered a lot today. 7 signs, 7 chances to catch something before it catches you. And I want to be honest with you about something that's the hardest part of my job. Sitting across from a patient who has had all these signs for years and is only just now finding out why. Not because they didn't care, they cared deeply. They just didn't have the information. You now have that information, and I want you to do one thing with it. Just one thing. Tonight, before you go to bed, sit down and look at your feet, legs, and eyelids. Observe the skin color, feel the temperature, check for swelling, wounds that aren't healing, or changes in your nails and skin. 30 seconds. That's all I'm asking. And if you see or feel anything on this list, please call your doctor tomorrow. Not next week, tomorrow. Because the earlier you catch a heart problem, the more completely it can be managed. In most cases, through lifestyle changes, medication, and a frank conversation with your doctor. You've worked hard for the life you have, for your independence, your health, your ability to do what you love. Don't let something as manageable as your heart health take any of that from you just because nobody told you what to look for. Now you know. If you found this video useful, share it on WhatsApp or Facebook right now. Tag someone you care about, a family member, a friend, a neighbor. You might be giving them something they didn't know they needed, a gift that could save a life. And if you want more conversations like this one, I post a new video every week on this channel. Topics that matter for your health, especially after 40, 50, 60 years old. Things I talk about with my patients that most people never hear outside a doctor's office. Subscribe and bring someone you love along with you. I'm Dr. Mark Johnson. Stay aware, stay proactive, and take care of your heart. I'll see you next time.